Hey, Dr. Yates here, and today I want to talk about bloating. And this is more of a ramble because I have so many clients that come in with this concern every day, and I want to discuss some major things that you need to consider when you're dealing with bloating. One, is it upper abdominal bloating or is it lower abdominal bloating? Two, does it come on right after eating or does it gradually get worse as the day goes on? So let's break those down. Most people, gradually gets worse as the day goes on, and it's more lower. If that's the case, before you do anything, you have to make sure that you're not struggling with constipation. Because if you're struggling with constipation, there's no point changing your diet, trying to figure out what foods are the problem. You need to get the bowels moving regular first, because it's very difficult to figure out if any foods are causing bloating when all of a sudden one day you haven't gone for 3 days and then you empty out the next time and you feel fine and you're trying to figure it out compared to foods. Go to the bathroom every day. After you get the bowel movements sorted out, then we can start looking at foods. So from a food standpoint, you can start seeing, is there anything else that's causing it or triggering that? Now, from the upper abdomen, if you're getting bloating right after eating, especially if it's accompanied with any heartburn or indigestion, there's a few fixes for that. You want to start with the most simple fix that involves the least change first, which I have found to be related to the position of the stomach. If this is your stomach and this is your diaphragm, it's not uncommon that the stomach kind of gets pushed up a little bit, especially if you're getting any type of acid reflux or indigestion with that bloating. You pull the stomach back down, and I've seen cases, I just saw someone yesterday who took 30 seconds to correct it, and now it's done. So it's always start with the simple things first to make it easier on yourself. After that, then you want to start looking at, I find, upper abdominal bloating. It's a lot of people, when they pull back on a lot of the refined carbohydrates and refined sugars, that bloating will then go away. And finally, if you just find that the bowel movements are regular, you're not getting any heartburn, indigestion, but your bloating's still a problem, you can use things to stimulate your digestion. So I usually recommend a bitters formula, and the bitters stimulates your digestion so you digest the food better. It helps kill off any problematic bacteria, yeast in the system to balance your flora. That helps a lot. So those are just a few tips that I found that you can easily implement right now to kind of start helping with your bloating if that's a concern for you. Now, at the same time, if the bloating is cyclical for females and it only comes at a certain time of their cycle, then we'll dealing with a hormone issue, and then we'll deal with that appropriately. Hope this was helpful. Bye.